Syphilis rates are rising in South Texas, but most of those new cases aren't in the group of people you'd expect. Here's Bella Michaels.
Syphilis cases are rising in South Texas.
It's an issue across the country. The cases have gone up like more than double over the past 10 years or so.
Health experts say cases are diagnosed more in young adults in their 20s and early 30s. We spoke with some UTRGV students about the sexually transmitted disease.
I hope to assume that the people I hook up with are clean.
He encourages others to practice safe sex.
I think it's important because not only for STDs, but most of us cannot afford to have children at this time of our lives. I think if you don't, you can face the consequences, and we all see what those are.
Pregnant women also need to be aware of the consequences.
For example, a woman who has syphilis during her pregnancy or early in her pregnancy can lose the pregnancy. There could be perinatal death of the infant after it's born.
An infected mother can pass the disease through congenital syphilis to her baby. According to state data, in South Texas, there were nearly 30 more cases of congenital syphilis between 2021 and 2022. Dr. Castillo believes the pandemic played a role.
What we're seeing is the consequences of all of that lack of testing.
He says people weren't getting tested as often as they should.
There's a lot of stigma about this, and it's really awful when that stigma gets in the way of saving a life.
If it goes untreated, it can lead to several serious health issues. It can be tricky to identify syphilis on your own. The best advice is to go see a doctor if you believe you may be infected.
Just because things look okay does not mean they are okay.
In Edinburgh, Bella Michaels, Channel 5 News.